Well, thank you and good morning and welcome to the second annual Northwest Illinois Volunteerism Conference. I'm Pam Clark-Reidenbach with the Northern Illinois Center for Nonprofit Excellence, and many of you know Billy Callahan. She's the Associate Director. Wave, Billy. Yep. Nickney and the Leadership Exchange on Volunteerism participants with the support from Serve Illinois Commission, AJ Gallagher and Company, and Imperial Punch of Rockford, presenting a full year of online interactive volunteer management programming focused on creating a culture of connection and inclusion in volunteerism. Each monthly session includes a 1-hour presentation followed by a 1-hour group discussion moderated by our friends Carrie Acevedo and Martisha Brown. We ask all participants to mute their computers for better reception for all and to type questions into the chat box. You'll have an opportunity at the end of the presentation and during the discussion to unmute and participate in Q&A and dialogue. So let's get started. It is truly my pleasure to introduce today's presenter, who will be speaking on the topic of how to engage episodic volunteers for your large event. Dr. Alicia Schatteman is an associate professor of nonprofit management and the director of the Center for Nonprofit and NGO Studies at Northern Illinois University. She has over 10 years of nonprofit experience, including 4 years as an executive director. Alicia earned her Ph.D. in public administration from Rutgers University, and we could not be more pleased to have her as a colleague at NIU. So please help me to welcome Dr. Alicia Schatteman.
Hi, everyone. Nice to be here. So Billy, if you want to let me share screen, I will go over to my slides here. And I have to close out. There's so many things that are open, which always happens. So when we were, I had met with Michelle and Colleen here a couple of weeks ago, and we were talking about this program and how it started and what you're going to hear about today. And the world has completely shifted. And so has our presentation in many, many ways, and in terms of the people who are going to do this and talk about these things. So we're really glad you could come with us today. I recognize a bunch of people on the call, and for those of you who know me and I haven't seen you in a while, it's nice to connect with you. And I think there might even be some former students, so welcome to the presentation as well. So when we first kind of put this together a million years ago, we were coming into the election and we were doing census, and so we were really going to focus on those two events, and then the world changed and we went to this kind of format because we needed to do virtual, but a lot of things have changed kind of in the meantime. So when Colleen and Michelle and I got together, we talked about, well, what are critical things that we think that people who are engaged with volunteers kind of need to know. So I offered to do kind of a intro background research, and then really what you want to hear is Michelle and Colleen talk about how their organizations, what they use volunteers for, how they use volunteers during this pandemic, and what things have they really changed that they might actually adopt kind of after all of this crazy is over. So I might do more of the academic stuff, and then Michelle and Colleen, they'll dig into how these organizations have actually adapted. Okay, so let me go forward maybe. So I look at it as volunteerism under that big tent of civic engagement. And that's where people really want to make a difference in day-to-day civic life. It's both knowledge, skills, values, motivation, but it really is the people that want to improve the quality of life in their local community. And really in the literature, there's lots of different ways to define this, but that broad category of civic engagement includes things like civic action, civic commitment, civic skills, and social cohesion. And mainly where volunteerism falls under is this notion of civic action. So this is really volunteering as well as service learning, and that refers to any time students are doing something within a class or as part of their curriculum to volunteer. We call that kind of under service learning. And interesting teaching in our Nonprofit and NGO Studies program here at Northern. It's an undergraduate program, and so a lot of our classes have service learning components. And it is one of those 11 high impact practices. So the ability for our students to really engage makes a difference in their overall learning. So volunteering, and many of you who work with volunteers, you kind of already know this. Volunteering remains strong, but it also has been pretty stable, about 25% up to 26%, depending on the numbers that you look at. It has remained pretty consistent. Now, as a researcher, one of the things we always question, well, how did you come up with that number? A lot of that is done through surveys because there's not a great way to capture this data. Another way sometimes that researchers look at is they scroll your 990s and you indicate how many volunteers you have as an estimate. So that's kind of another data point. But there's a lot of volunteering that happens that is not captured in that 25 or 26% because so much volunteering happens informally and it is just not, through surveys or other forms of data that we might have. We probably, this doesn't come as a total shock to you, but when you think about volunteer participation, overwhelmingly women and significantly related to age, although you'll see here that there's high volunteerism among all age categories. But a lot of that has to do when you have children, you're doing things that are related to parenting and in schools and things like that. So probably in most of your organizations, you're looking at women who are over 55, things like that. Michelle can and Colleen can talk more about that as who their volunteer kind of base is. And why this matters is especially during COVID or in other large scale events is who's going to be affected most. And one of those areas is looking at this chart, and I'm sure in your own organization, is there is some gender issues in here, but then there's also some age issues, and I know Michelle and Colleen will comment on that as well. So volunteering really does span generations, but how they volunteer really does change over time. So if you have kids, you know that they're doing, they might have hours of community service they have to do, and those are kind of one-offs, come for a day, come for a few hours. We did a couple of those through the holidays with the kids, which are great, but they're not as engaging as some of your volunteers. When I was an executive director, my dream volunteer would show up every Tuesday from 2 to 4. She would never miss. She was like, but she wasn't coming on Monday and she wasn't coming on Friday. She was coming on Tuesdays from 2 to 4. And she would know exactly what she had to do. She was trained. She just came in and did her thing. So that's kind of a dream volunteer in that they are completely self-sufficient. They don't need a lot of supervision, and they likely have a lot of background skills. Versus your 15-year-old who needs community service hours by next Tuesday, and you have to find things for them to do, and you spend all the time actually doing the volunteer work with them versus them. So that's not the dream, but you're like, well, I'm really supporting their interest in volunteerism, so I'll do it this once. But so the kind of both ends of the spectrum. So how they volunteer over time is definitely different. You probably also know incredible health benefits of volunteering, and this is really what we're missing a lot right now is the social, getting together, and it is really important both for our physical health and our mental health. And I think as you think about this event, how do you substitute experiences for the overwhelmingly positive benefits, health benefits of volunteering at this time? We also have a couple of challenges when it comes to diversity. And I know that some of you are thinking through those things now, especially trying to figure out what practices, policies that you do that might limit the volunteers that you have. And here's my kind of plea is that we need data. We're just completing a nonprofit study in DeKalb County, and we did ask organizations about what kinds of data they collect. And some surveys, which is why we didn't ask it this way, some surveys ask, how many of the people that you serve, are they African American, or of the people that you serve, do you serve people who live in a certain geographic region, et cetera? So what we wanted to do is, instead of asking that, because that's a lot of guesswork sometimes, we asked them, do you actually collect that data? Do you collect diversity data? Again, diversity, big tent. Age, gender, sexual orientation, race, ethnicity, disabilities, income, geographic experience, and there could be others. This is a long list. Do you collect these things for your staff, for your board, for your volunteers, and for the people that you serve? And what we found so far is not a lot of organizations are capturing that data in all of those populations. So at least here in DeKalb County, about 24% are doing a pretty good job capturing data on the people that they serve. And mainly that's at the request of sometimes funders. particularly grants, will say, how many people lived in this county did you serve? How many people were in this age group? So that is getting captured. Much less so when it comes to volunteers and when it comes to board. And then how do you do those things? We're looking here at NIU, we're looking at voluntarily giving that information through our HR system, for example. So there is a way that we can capture that data, but you have to think through that. It has to be a voluntary thing. But you don't, until you have that data, you don't know how representative your population actually is to your community, because we don't want to necessarily guess about someone's race, ethnicity, disabilities. So those are, my plea is to figure out how can you capture that data to start, and then what does that mean for your practices or for your recruitment when it comes to volunteers, is how well do you match then your community. So as I mentioned before, students volunteer, which is great. NIU does an NIU Cares Day, a one-day of service, which is wonderful, but can be pretty low engagement with the organization over time. I know several local organizations, they put into policy that they will only take a volunteer who can commit to 1 year, for example. Well, that might knock out a lot of volunteers who are only on campus for 8 months, but they've decided it's just not worth it for us to go through the heavy, human resource kind of resources to train people, orient people in order for them to leave in 4 months. So that has to, that's your call, how you want to do that. But they are a large group of individuals who might be interested in that. When it comes to students volunteering, whether that's a one-time event that you might have or a real need that's maybe ongoing, things to think about is our students, because they individually are facing much higher costs for their individual education, they are working more hours. So I have students who work the equivalent of a full-time job and have a full-time load. So they're taking 15 to 18 credit hours, which is 5 to 6 classes, plus working 30 hours a week or 35 hours a week for lots of different reasons. Sometimes it's they need health insurance, and sometimes they're the support kind of to their family. So as you think about students, know that it would be great if they could volunteer, but they're really under a lot of kind of financial pressure. And then some young adults might have negative stereotypes about volunteering. So things that I hear from my own kids and others is that, well, they want to recruit younger people, but then when I go there, there's nobody my age to hang out with. I don't know where I should go. They don't talk about things that I'm interested in, or I don't talk about things that they're interested in, whatever. So they might have some negative stereotypes about volunteering that you might have to overcome, either in your recruitment materials, online or whatever. Here, because we do have an undergraduate program, we do several internships. This one is just a profile of Sarah. We do around 15 to 20 each semester internships, and about 70% of our nonprofit students have done at least one internship by the time they graduate. So if you have a program that's in your area, reach out and see what they offer for internships. Our internships can be repeated each semester. We do have some students who stay on at the same organization for the whole academic year. Currently, we offer a stipend through the DeKalb County Nonprofit Partnership of $575 for those interns. But I will tell you, more and more, we would like to move to a fully paid internship, because the pressure on them to earn money in addition to doing the internship really creates an equity challenge. There are only certain students who can actually work for 10 hours a week without having their gainful employment. So we are definitely, want to support the financial health of our students so they can give up some of those jobs and focus on the internship in their school. In this COVID era, we've definitely seen organizations move to a virtual internship or virtual online opportunities. And I would say, and maybe Michelle and Colleen will comment on that it really has changed how we think about internships and volunteer experiences through this online idea. How do you recruit and orient a completely virtual volunteer? How do you give them meaningful work and yet preserve maybe the privacy of your data, for example, which tends to be one of those things that maybe interns could work on? What technology tools and training do they need? So students definitely have a lot of technology, but it's usually their phone, and there's only certain things you can do with that. They don't have great internet usually where they live. They might be sharing it with roommates or just for cost. And how do you supervise those interns or volunteers remotely? And then building community. So all things to consider as you think about, we really want to do a virtual internship or volunteer experience, but there's definitely some challenges. It might mean buying equipment. It might mean some more training, but lots of things to think about. And then what will stick after this? A number of students have already said that, well, I'd like to do an internship next fall, but I'm going to be moving. Is there a way I can still do an internship? So even potentially after this is all over, what will we have that people could actually engage with virtually? It does open up a lot of potential for persons, for example, with disabilities or people who have transportation challenges, that they don't have to be physically on site. So I think there's a lot of opportunities there as kind of we go forward. There's lots of areas for national service, and I'll just bring up a couple because we recently had a student that took an AmeriCorps position with the Northern Illinois Food Bank. And for those of you who are, have the capacity, certainly look into the AmeriCorps program and think about applying to that. There is a cost, but it's not significant, far less than if you were, hiring a full-time employee. So it's another way to stretch your human resources without, having the 100% of that expense. So I bring that up as a potential kind of service learning opportunity. We've all seen the civic PSAs for wear your masks. That kind of all falls under that civic engagement piece. And then philanthropy, I just want to touch on this before I turned over to Michelle's. Philanthropy can be a form of civic commitment. And I think we've seen that change over time. Lots of traditional and non-traditional ways, everything from online giving to giving circles, which is certainly growing, continues to grow across the country. And we've seen this rage donations, which is so new this last couple of years of you're just angry at something that's happening. So you do the complete opposite and support an organization. And so we've seen that during the first Trump election and donations to ACLU, they jumped 500%. So sometimes I just love that image, but rage donations. So now we're starting to think about that. When something terrible is happening out there in the universe, is that an opportunity for you to be soliciting and talking about that in your own organizations? Of course, everybody sees the Bernie meme, which I just love. What I really love about this whole thing is this is the CTAs. I had to put in a Chicago focus, but oh, I didn't get it. It didn't show it. He, as a result of doing all this, he donated several millions of dollars to charity for his in nonprofits in Vermont. So it was really cute. It was a fun little meme, but also it was driving philanthropy in that local community. And then we have things like civic skills that fall under. So if you're able to support those things. In this last election, we saw a really increase in voting, which was great. And then just overall, our youth have a lot of examples of people their age trying to make a difference. So they're not short of role models, I guess. And so as much as you can encourage to build that, the challenge there is that their interests are global. And so if you're a local nonprofit organization, you are challenged because they also care what's going on in Myanmar and in South Africa. And that is a challenge because this generation is more global, more diverse, and more tech savvy than any other generation. Lots of things going on in social movements. And then we also have a couple of things coming up in our own here at our center. So if you're interested in kind of exploring some of these areas in this larger tent of civic engagement, we have a few that are coming up. And I will turn it over to Michelle. As Michelle gets her slides up, Michelle is the executive director of the DeKalb County History Center. We've been working together for a while because we both share a passion for history. So I'm pleased to be joined by her this morning. Welcome, Michelle. Oh, you're on mute still.
Sorry, there we go. Okay, back to this. Okay, we're all good?
Perfect.
You can hear and see my slides. Fantastic. We're off to a good start now. Well, thank you so much for the opportunity here to share just a little bit about how the DeKalb County History Center works with volunteers and how that's changed over the past year. As an introduction, just wanted to give you a little background about our organization here. Our mission is to inspire curiosity in DeKalb County's history. And our vision is to explore the diverse stories that are part of our county's history, to gather people together through exhibits, programs, and research, and inspire people to apply this knowledge to enlighten the decisions of tomorrow. This is a big, lofty list of things that we do here, and to do them, we really need our volunteers. So who works here at the History Center? I'm the only full-time staff member. We have 2 part-time people. But volunteers over 60 are in the, well, previously had been in the building on a regular basis. And I'll go into a little bit more about them in a minute, but as Alicia alluded to, we also have events over the year with NIU. They have the NIU Cares Day. There's the United Day of Caring. We have scout groups and church groups that all come out here for special projects as well. But one of the key components of our volunteer corps is that most of them are retired and they're over 65. So today I thought I would just give you a brief overview of what we're going to take a little bit of a deeper dive into. So I'm going to be providing the examples from a small nonprofit, whereas Colleen will give it a much larger organization's perspective and experience. I'll talk about how we operated pre-COVID and with all the on-site activities that we had going on here, the COVID shift to off-site projects, and then the perspective of what did we learn and what are we going to keep and what are we going to be so happy that we won't have to do again, hopefully for a long time. So volunteers are really the lifeblood of our organization here at the History Center. As I was getting ready for this, it just made me so happy to see people together and just smiling, and I just miss seeing that, and it was definitely a big part of what happened here on a regular basis. We had day camp groups coming out here working in the garden. We had families coming out here on special events during the weekends. We had our fall festival here that usually, it was just a nice intergenerational activity for a lot of families. And then we had programs on days off of school, and they were really, you know, our calendar was just filled with all sorts of events like this. And the volunteers helped us staff and plan and clean up all of these things. So again, the volunteers were definitely part of the daily life here at the History Center. And then we have our smiling face volunteers. And these are, again, these are the people that really helped us keep our doors open. You walk in, you'd see, you know, Rod here, and he would, you know, if you were going to see the exhibit, he'd collect admission, or he'd sell something in the gift shop. If you were here to do research or a program, he'd direct you where you needed to go. And, you know, it was just, without these people that were here 5 days a week from 10 to 6, we couldn't operate. And then March 13th happened. Actually, it was March 12th here for the History Center that we had decided that we were going to temporarily close because our volunteers were considered high risk, and we just didn't feel like there was enough information to even create policies or procedures and how to keep our volunteers safe. And it's just, these were people that were at risk of getting very sick and dying. And as an administrator, I did not want to, you know, put them in harm's way. Some of them were just like, oh, it's fine. I'm like, no, it's not. We deal with the general public. We have no idea who's coming in. So we're just going to hit the pause button, and then we'll reevaluate. Well, obviously, a week later, the state of Illinois completely shut down, and museums were not able or allowed to open until July. So we still had the challenge of a couple things going on here. So as I mentioned, most of our volunteers were in a very high risk group. But we had two perspectives going on here as the summer went on, is how can we keep them engaged and safe? So that was, you know, kind of my perspective from the History Center. And then we really had to look at the perspective of our volunteers. What is their level of comfort? Do they want to come in? And if they still want to volunteer and work off-site, how are they going to feel in working with new types of technology? I have to tell you that I was definitely the first Zoom call with about 80 to 90% of our volunteers. So some really important things that, again, there was a huge learning curve as we all went through this, but some really important things with, you know, any organization is communication. And as Alicia kind of touched upon, that social aspect was gone. And we talked with our volunteers all the time, you know, especially the changing of the guard at the front desk. You know, I'd come out and greet, welcome, you know, thanks for coming in today. Here's what we have to do. And then, you know, with the two volunteers, sometimes, you know, the person coming in would spend an hour talking to the person leaving, and we'd see each other in the break room, we'd have lunch together, and that was all missing. So we started to send out a newsletter. At first, we tried to do a Zoom meeting with everybody, and they didn't do it. No one showed up. So we were able to figure that out later on, but we did keep that communication open through newsletters. And then not only were a lot of our volunteers over the age of 65, a lot of them lived alone, and we were really worried about them. So we then were able to divide and conquer between our staff and board to just call and, how are you doing? Do you need anything? We've got toilet paper. Do you need toilet paper? You know? So that was really important to, again, keep them connected to our organization. Meanwhile, we, as a staff and board, we had to think, optimistically about, what's reopening going to look like and what are those safety procedures. So we did share that with the volunteers and wanted them to know what our game plan was. And again, what is their level of comfort, because we didn't want them to say, well, if I can't come in, then I can't volunteer anymore. So we just sent out a survey to them. What are you willing to do? So with that, we also had to then pivot as an organization of what can we have them do if they're not here, because we've never really had to do that before. One of the, again, Alicia kind of talked about her awesome volunteer that was there, every single Tuesday and Thursday from 2 to 4, and we had that group too. We had volunteers that were actually here 40 hours a week. They were very competent, and so we were able to find that at any desk, and they could access their computer here at the History Center and keep working on some of their projects, especially because there's a database that it had to be, there wasn't, you couldn't access it from your home computer. You had to go through it, the computer here at the History Center. And some of them jumped right into that. They're like, this is great. I can do this. And I can even do this when there's a snow day in the winter. And they're going to be doing that this next week when it's really cold out. So that was really a simple fix. Then we also thought about who our audience was, as well as who our volunteers and what their needs are. So teachers were also really struggling in remote learning and having to come up with a variety of resources. So I'll give some examples of how we worked with teachers. And then the other two, both with the collection and long-term projects, those were kind of things that were on the back burner that, okay, we've got things that we've talked about doing for a long time. How can we make those work offsite? And then we also had to cancel one of our major fundraisers, and it's like, okay, so how can we have volunteers help us out with that? So with educational resources, we had a teacher who also volunteered with us in the summer come in and teach us how to use Google Classroom. So not only were our volunteers learning new technology, we had to learn as well. And this was fantastic, because one of our challenges as a county historical center is that we have, our county from north to south is about 45 minutes long. And we're not going to get groups from the southern part of the county very easily to come up here for field trips. And here is a great way for us to help them have an immediate need met, as well as provide them with some primary sources and something that they can use long term. We also realized that we needed to do a lot of video work, and that wasn't in our skill set, but we did have contacts with some recent high school students that were involved. It's called Spartan TV. It was, a lot of media, video recording and editing, and these were now freshmen in college that were staying at home this semester. And they were phenomenal in helping us do a video of a walking tour that, it took an hour of, me going up and down. So here you can see is, a little clip here. And then they also helped us arrange this in Google Slides. And this was just going to be, again, another great resource for people that couldn't physically participate in the field trip. Transcription. This is one of those back burner projects that came to life during this, during the pandemic. The lost art of handwriting. A lot of our, there's a big gap in the population of people who can read handwriting now. And as a historian, that really makes me sad. because most of our stuff is in handwriting. But that's something that our volunteers can read. So we turned their skill set into meeting something we had here at the History Center. We have all of these township records, mostly from the early 1850s. Some of them have great handwriting, you can see here, and then they turn that into these beautiful searchable documents that a lot more people are going to be able to read. There were also all of the social justice issues that were raised over the summer, and as an organization, we really wanted to do a better job of being more inclusive in the stories that we're telling, but that wasn't the strength of our collection. So we wanted to be able to do a better job and kind of what do we have available right now that could help us answer some of these questions. And one of the obvious tools to be able to look at is, who lived here, is through looking at census records. There's a lot of material to go through in a census record, and that's nothing that I certainly would have time to do. But we had a group that started as a civil rights book club, did a presentation to them, and then they're like, what can we do to help? How can we start changing the conversation? And so we have this group of people that it's all online. They're going through the census records. Here's just a sample here, and yeah, the name, age, sex, and their color of skin. And these B's here for Black jump right out off the page here. And we had no idea. We've already started learning so much because of their research about where these communities were within these larger towns and townships in our county. So it's already made a big impact in our research. The same thing with online newspapers. They're doing a deeper dive into finding stories online. We think, oh, it's online, it's available. Well, we found quickly that it's not necessarily, super reliable because the OCR recognition in some of our newspapers did not correctly read here Frederick Douglass's name. So if you do a search for Frederick Douglass, he will not come up. But he was here in Sycamore in 1870. He's listed here as Douglas and his name is spelled wrong. Obviously, we did a couple variations of his name, but he's not listed as Frederick Douglass. So we didn't know until we started doing some of this research. We also had, those things that you never have time to do, writing up those procedures. And again, we had a volunteer that, even just over the holiday break, put in 300 hours. So she's super dedicated. She's super awesome at what she does, but she's one of the only people that knows exactly what she does. So I said, you know what, when you need to take a break from doing all the fun stuff, I need you to write up some procedures about what you actually do. Because with everything that's going on, we can't just have one person know how you do your job. Then just to touch upon fundraising, we have a virtual house, we have a house swap. It was virtual this year. For that, we use over 80 people that help share stories and, do security in people's homes. We moved it all virtually. We had an intern that helped us create this beautiful scrapbook with all the information, but we also had interviews with 2 homeowners that were fantastic. And we had an NIU honor student that was looking for a project. And so he did all the video and editing for this project as well. So what did we learn? Some of the benefits that we saw right off the bat is that previously we were limited by our hours of operation. And having offsite projects made it a lot easier to connect to volunteers who work. I don't know what's going on, it's cabin fever or what, but since the beginning of January, we've had, I think, about 12 people email me about how can I volunteer, and they're available evenings and weekends. Well, that wouldn't even normally be a good fit for us, but now we can get them to work and engaged in our organization. The switch to video work certainly attracted younger volunteers, and they're awesome at that. That's like they can do that in their sleep. I can't imagine how long it would take me to figure out how to do some of this stuff. So we also were able to reach some younger volunteers. And as a consequence, because of the work that these volunteers are doing, we are now able to, down the road, we're going to be able to connect with a larger audience. Some of the drawbacks here is that social aspect. We have volunteers now that I've never met. And so I look forward to that day that we can certainly have, a volunteer appreciation party at least. But that's kind of surreal to think about that there's people that are helping us out that I've never met in person. Also a challenge all the time is volunteer hours, but now that they're working at home, it's even harder. You know, they would come in, we'd have them sign in and we know when they were here. So that's like, oh, Michelle, it's not a big deal. I'm like, it is, because we're a small staff. We need to show that we do have a lot of people that are helping us meet our mission and our goals here. And sometimes we have people that are like, no, I want to learn, I want to do stuff. So we have, you know, a little bit more time for training on the staff side. But the volunteers, they're picking it up. And as this has gone on, they definitely are learning and often running. So what are we going to keep? We are going to have guided tours. We are open right now, but still with limited hours. And a lot of that is due to we just don't have the number of people willing and comfortable to come and work physically at the History Center. We are going to continue to work with researchers by appointment, again, with limited hours. And we are going to continue our video work. That is something, this was a cemetery walk that it's a lot of research that goes into this event. It's on one Sunday in October. And now we're going to be able to share that event with people that weren't available that day. So we are going to continue to promote our offsite volunteer projects. We are going to continue to provide research videos to reach more people. And we are definitely going to target younger volunteers who enjoy working with technology. So there you go. I don't know if you want to wait for questions at the end and just jump into Colleen's presentation, but I'm flexible either way.
I think that's what we'll do. There's a couple of questions, but yeah, we'll hold them.
Okay.
So if you want to stop sharing, and then Colleen wants to start. So Colleen, if you didn't get a chance to read her bio kind of when we started, she's the Nutrition Programs Director for Voluntary Action Center, more commonly known as VAC. And if you're in or around DeKalb County, you'll see the heart on their vans and buses and things like that. So that's usually where they get a lot of name recognition. So Colleen, you want to share your slides? And if you can't, I can try to bring them up too, but. Oh, there you go. We can't hear you yet. There you go.
You can hear me now?
Yep.
Okay, good. Because I have sometimes problems with Zoom in my audio. So
We can hear you, but you're quiet. I don't know if you can get any closer or anything like that. We can hear you though, so people might just have to turn up their speaker.
I'll just try and talk loud too.
Okay.
I use my laptop to log on. That works a little better.
Okay.
Okay, well, I'll start off with a little information about VAC and what we do. And then I can kind of move into our volunteer program and how it was affected by COVID. So Voluntary Action Center is committed to providing high quality services that address the basic transportation and nutrition needs of its community. And we're actually now Voluntary Action Center of Northern Illinois, as we serve DeKalb, Kendall, LaSalle, Putnam, and Bureau counties. And we have, for our transportation program, we have our TransVac Dial-A-Ride, which is a door-to-door bus service. And then we also have our MedVac service, which is rides to out-of-town medical appointments. And currently our transportation program serves all of Kendall County, and that is run out of Yorkville. And then we serve the rural parts of DeKalb County, all of DeKalb County except for Sycamore, DeKalb, and Cortland. And that was just a recent change as of the first of this year. We lost the bid to the contract through the city of DeKalb to provide the transportation. That went to TransDev, who provides the Husky line. So our transportation program has shifted some as of the beginning of this year, but we are still providing the same services. And then we have our nutrition program, which offers the Meals on Wheels, which is meals delivered at the lunch hour to homebound seniors and people with disabilities. Senior luncheon sites, which is sites at various senior centers where people would congregate and have lunch. We have community daycare, where we provide meals for local daycare centers and Head Start programs. And we have the summer meals program, which provides free and lunches over the summer months for children in our area. And that's kind of an extension of the free and reduced lunch program from the school. So those children that, you know, rely on the schools to get their meals during the school year, now they have a source over the summer. And then we had a premier catering program, which is kind of like a fundraiser for our Meals on Wheels. It was a full service catering, and any profits from that would go to support the Meals on Wheels program. And then for our volunteer opportunities, we had a number of volunteer opportunities pre-COVID. Of course, we have, you know, volunteering to deliver for Meals on Wheels, which you use your own vehicle and you deliver to the homes of those on our program. And we have some paid drivers for MedVap, but then we also had volunteers. They would use our vehicles for that and drive people to appointments where they can go out up into the city or into the suburbs up to Rockford. We have Meals on Wheels assistants where they would come in to help with packing the food in the morning and getting it ready to go out with the volunteers, or helping at our senior luncheon sites with serving the food or cleaning up or preparing it there, packing it. And we use volunteers also to help with a number of different office work, you know, helping prepare our bags and lids, or doing some of our survey calls for us, or some of our assessment calls of our clients on the Meals on Wheels program. And we'd get volunteers that, you know, would be entertainers at our events that we would hold. Or we have volunteers that help with planning and running our fundraising events, or volunteer artists where that would and make greeting cards, or decorate placemats, or make little holiday decorations to send to our Meals on Wheels clients. And of course, we have our board of directors that is all volunteers that help with running our programs.
Hey, Colleen,
Mm-hmm.
can I interrupt you for just a second?
Sure.
You're really soft. So some people are having a hard time hearing you. So I don't know, could you maybe, is there an opportunity for you to turn up the volume on your computer?
See, that's the problem. My volume is, I don't know if it's just my webcam. My volume is all the way up.
Yeah.
I mean, the only thing I could, if I logged in on my laptop, that seems to work better, but I would have to connect there, and then
Just shout.
take me a few minutes, but
You can also switch to phone audio. That might be helpful. If
phone
you,
audio.
yeah, if you click the microphone icon on the bottom left of your screen, there's an option to switch to phone, and it gives you the phone number and the meeting access code to dial in.
Okay, I'm not sure I see that.
Yeah, you have plenty of
Also-
time, don't worry about it. Yeah.
I did also type it into the chat if that's helpful.
There's a, well, I see. But I don't see where there's a, is it supposed to be on the bottom of my, maybe if I stop sharing my screen. No. Okay, you said there's a microphone?
Yep, the little,
Oh,
oops,
okay,
you see it?
and then,
You'll click switch to phone audio. When you click that little chaser button on the microphone,
okay, switch to phone audio, okay. And then I just dial in with my phone?
yep, you can use your cell phone or whatever phone that you'd like.
I just use my regular phone, so. Which one of these numbers do I call?
Chicago probably would be the closest to us.
Okay.
And Colleen,
Yeah.
you may want to mute yourself on the actual screen there.
Yeah.
You might get an echo.
Good teamwork, guys.
Teamwork makes the dream work.
Can you guys hear me through the phone? I don't know. Can you guys hear me now? Oh, now do
Yes.
you hear me?
Yep.
We
Okay,
can.
there. All right. I'll just have to hold the phone then. Okay. So let me reshare my screen and I'll just go back then. Okay, can you guys see the screen okay then?
Looks perfect.
Yeah, we sure can.
Okay. All right, sorry about that. Oh, okay. So I'll just start back. So Voluntary Action Center's mission is to be committed to providing high quality services that address the basic transportation and nutrition needs of its community. And we serve DeKalb, Kendall, LaSalle, Putnam, and Bureau counties. Our transportation program is in DeKalb County and Kendall County. And we have the door-to-door, a dial-a-ride service, and we have a medvac service, which provides rides to out-of-town doctor's appointments. We can go up to Rockford and into the suburbs and into the city of Chicago for those appointments. And then our nutrition programs, we have pre-COVID, we have Meals on Wheels, where we deliver lunch during the lunch hour to homebound seniors and people with disabilities. We also have senior luncheon sites where seniors would congregate and we would provide the lunch for them. We have a community daycare program where we provide meals for local daycare centers and Head Start programs. And we have a summer meals program, which is an extension of the free and reduced lunch program from the schools that offers free lunches to children over the summer months when they're not in school. And then we have a premier catering program. Now, with COVID, we do not have the senior luncheon sites any longer. We did provide the summer meals and the Meals on Wheels programs, but those with some changes, and we haven't, our premier catering is on hold at the moment as well. And prior to COVID, we had a number of different volunteer opportunities where we're able to, we have drivers for delivering the Meals on Wheels at the lunch hour, and we had volunteers do some of the medvac rides as well. For Meals on Wheels volunteers, they would need to use their own vehicles, but for medvac, we provide the vehicle for them to use. We had Meals on Wheels assistants who worked in the kitchen to help prepare and package the meals. And we had congregate meal assistants who helped serve and prepare the meals at the congregate sites. We have office assistants, and we still use those. They help with phone calls, survey calls, and calls to check in with our clients. They help with some of the prep work, preparing for meals that can be done at home. We also had volunteer entertainers that would volunteer to entertain at our events that we hosted prior to COVID. We would have event volunteers that help plan and organize and run our volunteer events and our fundraising events. And then we have volunteer artists who would put together little decorations for the holidays or decorate bags and lids to give to the clients when we serve their meals, or decorate placemats, various things like that. Write simple greeting cards with words of encouragement to our clients. So currently with COVID, we are still accepting Meals on Wheels drivers. That's our main volunteer opportunity. We still have the use of our office assistants and our volunteer artists, but the other volunteers, mostly, those opportunities mostly are on hold right now. We do have some volunteers that are helping with events as we do change things to a more virtual rather than the in-person events. And our volunteers have been very important to us because, one, of course, they save us costs by using volunteers. With our Meals on Wheels program, we have 22 routes throughout the county delivering Meals on Wheels, and about 17 of those or 18 of those are filled with volunteers. So we really are able to reach far more people having volunteers with that program than we would if we had to have all paid drivers delivering the meals. It also saves in costs because they're using their own vehicles, their own gas, their own insurance. So that is something that's a great cost savings to us. But in addition to those direct savings of costs, we are able to assign a dollar value to the hours our volunteers give to us. And we're able to use that as our required matching funds to secure our government funds that we receive through the Older Americans Act. And having volunteers come in to deliver has increased their support of our programs. They become more familiar. They see exactly how the program helps and benefits the people in the community. So that, you know, we've had a lot of great support come from our volunteers. And then our funding for our program, we have local government funding from the cities and townships we serve. And we receive federal and state funding through NIA from the Older Americans Act. And we also receive funding from the DeKalb County Board and the DeKalb County Mental Health Board. We often apply for grants to the DeKalb County Community Foundation and other organizations. Then we receive community donations from community members, businesses, and those that we serve. And we also hold annual fundraisers each year. And then, as I mentioned before, proceeds from our Premier Catering is also another funding source that we have. So with COVID, there's been a number of changes. Of course, we needed to keep our services going. We were happy to be able to continue our service without interruption to get those meals to the people in need. We did have to close down our congregate sites because, of course, it was not safe to have everybody congregate together. It was not allowed either. So we were able to put anybody from those sites that needed the meals on the home delivered meal program. But we first had to come up with extra safety measures, procedures so we can stay socially distanced, and extra sanitizing measures to make sure things are safe and not, we're not going to spread COVID if, keep that out of our facilities. So we really had to kind of change how we ran our programs. And we also had to change in who was able to volunteer. Of course, a lot of our volunteers, like the History Museum, were people that are retired, being that you have to deliver in the middle of the day. That's when, our largest need for volunteers is over the lunch hour. And some people are able to leave work, take their lunch hour, and deliver. But with the with COVID and the need for people, especially those over 60, to stay home, our need for our program increased significantly. Since COVID started, our participation on the Meals on Wheels program has increased by about 60%. So that, of course, caused need for more volunteers or more delivery routes. And so we really had to come up with a way to change our demographic of who volunteers for us. We did lose quite a few volunteers throughout the year, but luckily with advertisements in social media and in the paper and just word of mouth, we had a great number of new volunteers that were able to come in, help us out, and cover not only our increased need for the program, but to cover for those that are no longer able to do it. We had more business people able to help out because they're working from home, so they had more flexibility to be able to deliver the meals at our lunch hour. But our other work, as far as our events, once we were able to figure out ways to continue to hold our events virtually, we were able to do a lot of our work through Zoom and through Microsoft Teams and have it all done virtually. We were able to continue to host interns by having them strictly virtual. So that was a bit of a learning curve, trying to figure out how they can help us if they couldn't be here, because previously a lot of the work was done right here in person, hands-on with stuff that only has access to it here at our facility. But we were able to really, some of the work that needed to be done changed because we just had to adapt and work on what issues were brought up because of COVID, and some of the other things that normally we would have interns help came a much lower priority and kind of put on the back burner. The higher demand for our programs also just made a lot more work and adjustment for us to have to figure out how we're going to get routes set up for all these people so that we can still deliver to them. It really depended on whether we'd get the support from our community, and fortunately we did have enough volunteers that we were able to increase the number of routes that we deliver and still have the volunteer coverage. We have had to make set policies and procedures on sanitizing and making sure we keep things clean here so that we can properly prepare the meals and are not risking having somebody with coming into work that has COVID. We do a lot of the same things that you see if you're going in to visit the hospital. We have the same checklist. Everybody checks their temperature when they come in. They ask the questions to make sure they're not feeling well. We've had to change those that work here. A number of them it's kind of gone hybrid where they work some of the time in the office, but then they have some days where they work remotely. And so that we can keep everybody spread apart. We've had to do a lot more via Zoom and via Microsoft Teams. So we're online and virtually working together. And it's just been a learning curve, keeping track of the numbers and what we can or cannot do. It's been, it's been a challenge, to say the least. And I think as far as our meal delivery, because that's the most contact that we have, we have changed and done a more no contact delivery. We want to be able to, of course, make contact with the people we're delivering to, because part of the benefits of the Meals on Wheels program was having a well-being check on those that we're serving. So we do that more through, verbal communication with them through the door, or our drivers will come there. We leave the meal, we're at the door and step back at least 6 feet, and then we wait to see that they are going to come and get the meals. And we do a lot more phone calls to check in on the clients and make sure they're okay if we're not hearing from them when we're trying to deliver. And we have volunteers that call to check in with the volunteers and or check in with our clients to see that they're doing okay, and making sure that their needs are getting met, or referring them to other programs if there's other assistance that they might need. So I think that's about all that I have for now. If
Great.
we have questions.
Yeah, Colleen, thank you. If you want to unshare your screen.
Stop share, yeah.
And then we can take a couple of questions. So it looks like there's definitely some questions around, so very specific questions, and then kind of more general questions. So kind of a specific question maybe for Michelle is, what kinds of equipment did you use to do your virtual tours? And did you provide it to the volunteers who actually did the recording and editing?
So we had a couple different things that we used. First, we had a grant to buy a video camera that had a really nice lavalier mic and all that, but there were some volunteers that was way too much to use, so they used their cell phone. And we learned there were some glitches with that, but we were, again, it was not a smooth process from start to finish, but now I think we've got a little bit more of a knowledge base in how to do this. But the cell phone seemed to work fine, just not outside. You picked up way too much wind and background noise, and people were cutting their lawn, and surprisingly that got picked up. So we did use those two options, and then editing software for it. So the high school students, they were really familiar with the Adobe version. So it was $30 to get them a 1-month subscription. And it was worth it because they did so much work within that month. There's also, it's called Capwing, which is a free video service. You can do up to 7-minute videos. And I think most of us know the attention span of people is not very long. So 7 minutes tends to be more than enough. And then you can do, I think, a total of 30 minutes of video a month, and that's all for free. So that's what we've been using on the free side.
Both of you mentioned new volunteers joining your organizations during COVID. How did you do orientation or kind of onboarding with a brand new volunteer that had never been in your building before? Colleen, you want to take that one, and then Michelle, you can give us your response.
Sure. Well, we've done more of that over the phone, and we've created documents to kind of explain the procedure for delivering and our no contact policy. So that would be something that most people would have email. So we'd email that information to them. And then when they did come to pick up meals, that is the point when we are in person. So we would, of course, everybody is required to wear a mask. Employees are required to wear a mask here while they're working, and then any volunteers are required to wear a mask. So we just try and answer any questions or give any direction briefly when they're coming to pick up the meals. But prior to that, a lot of it was just phone conversations and email.
Michelle?
Yeah, ours were, because they were younger, we just connected with them through Zoom, and it was much more project specific as far as the orientation versus when we normally meet someone, we give them a tour of the building, we introduce them to all the other volunteers, and with us being closed and not having a lot of people here, it just didn't make sense. So again, when things hopefully within the next 6 to 9 months get a little, we'll welcome everybody back and have kind of we know you've been a volunteer, but we're going to do a new kind of just volunteer, just general training. And maybe, maybe they're not even interested in that, they want to come home, they want to do something that's contributing to society, but they want to do it in their pajamas after work, and that's fine too. So I think that's just kind of a different mindset as an organization about what it means to keep people connected. We have to kind of do it on their terms and what they're interested in at their level of commitment.
Yes, some folks were interested. Are your volunteers talking about they're anxious to get back in the building as soon as they get a vaccine, they're coming back, or maybe not?
We have not asked that question. I know we've got a couple that they're really excited to get the vaccine, but there's still unknown things about, are you still spreading? And we don't, and it's not just the volunteers, but it's also the public and who's coming in. Over the summer when museums were reopened, I believe most museums were, even with reduced capacity, we're still only at like 10% capacity. So we just don't have that foot traffic right now to get people back in the building. We don't have that need at the moment. So I don't know the answer to that question. I'm missing everybody.
I know.
So hopefully, that social part will be the first step in getting people together, and then we can have a different project for them than they normally have been working on. But I hope to get people back here once they start getting their vaccines. That's the good part about the older volunteers. They're first in line. So.
Colleen, have your volunteers said anything specific about the vaccine and how that'll change their volunteering?
We haven't actually, directly asked that question either. I know we have had volunteers we check with in with them regularly, and they said they'd like to come back. They just need to wait until things calm down or improve more. We have some volunteers that just are subs that fill in as we need them. We have some that deliver once a week, and then we have some groups like businesses and churches that sponsor a certain month of the year. And for those, we've lost some of those. They say, well, keep me in mind next year. We just can't do it this year. So they're just kind of waiting to see when things are going to improve, and they want to be kept on that list. And they want to deliver again as soon as it's feasible. As soon as people are comfortable doing it.
Great. I don't know, Billy, if you want to transition over to the second part. I know some of us have to move on, but I'll turn it back over to Billy. Or Pam, whoever.
Turn it over to Pam.
Yeah. Well, thank you. And thank you, Alicia. Thank you, Michelle, Colleen. We really appreciate your time today, sharing your expertise, right? Your wisdom with our organizations in the Rockford area. We're really so fortunate to have such incredible, extraordinary professionals in our region that we can tap. And I also say, Michelle and Colleen and everyone in the sector, how you have done just an extraordinary job of being creative and to really be resourceful in how you respond to COVID. I've heard story after story from organizations and the extraordinary ways that they have just really used their creative ability to pivot and continue to provide critical supports and services to individuals. So thank you. And thank you for being with us today. We really appreciate it. Thank you so much. And so it is time for us to pivot. And so to introduce two more extraordinary, amazing nonprofit professionals, we'd like to bring in Carrie Acevedo and Martisha Brown, who will facilitate the dialogue after this session today. Thanks, Carrie. Thanks, Martisha.
Yeah, thanks so much. Thanks, Alicia, Michelle, and Colleen. Certainly great to hear from you and hear your perspective. So I know, Michelle, you've got to drop off. So thanks for being here with us. I think Alicia already did. So Colleen, you're welcome to stay and hang out with us and answer questions. Otherwise, thanks for your time. We appreciate you sharing your talent and information with us. So good morning. It is 2 degrees outside. It's a little warmer, inside, but thanks for being with us on this cold morning. And we still have, 41 people still participating in this. And so we're super excited to have you today for this discussion. So I'm going to start the conversation like I always do. So you should always be prepared for this first question. Tell me your aha moment. What was the thing you wrote down? What's the thing on your notebook that has a little star next to it, or that's underlined, or that says, take this to my boss? What's the thing you heard that was like the most important point for you today? Your aha.
Sorry, I think I learned communication.
Cool.
Communication with your volunteers through this whole thing is hugely important. And it's the only way you're going to keep them to come back when we do reopen.
Yeah. Do you go by Cookie?
No, it's Cook, Terry. It's yeah,
Terry. Hi, Terry. Can I call you Cookie? I'm kidding.
Sure.
Oh, Terry, this is why Zoom is so fun, right? Sometimes my board members log on with their kids' names.
My email.
Jason, are you Alicia now? What's going on? So Terry, who do you work for?
Neighbor Settlement.
Oh, fantastic. Welcome. We're
Thank
super glad to have you. Yeah. Yeah, that was probably a really some useful information for you to hear.
It was. There was a lot of information that I will pass along to our curatorial board or that type of group. I handle the more special events portion.
Okay.
So a lot of what I heard, from there, I will share with others.
That's great. Thank you. Thanks so much. Okay, who else? All right, I have a couple here in the chat box. Esther, lots. Thank you. That's always a really good thing to hear, right? But I love the realization that young people like to work with technology. Also looking at what work volunteers can do from home that maybe we had not thought of before. How can we think outside the box more? I loved Michelle's work to reach people who would not usually be available and take advantage of volunteers who work 9 to 5. Yeah, that was definitely something that I took away from that too, was right, that they took opportunity to do all the back burner stuff that they weren't able to do, and found all of that interesting information about Frederick Douglass, right? I live in DeKalb, so like, what a cool thing for them to be able to uncover in the time of COVID, which they likely would not have been able to do at another time. So Esther, I think you're right. Yeah, there's lots to learn about what we can, what we can do and how we can pivot. Who else has one? I see a couple people have joined us on video, so thank you for that. It's always nice to see faces. I know for some people it's really hard to join with video because then the system lags. But it's nice to see your faces. Hi, Barb. How's the Will County Forest Preserve?
Doing really good, really good.
Good.
I think the aha moment was the diversification of contacting your volunteers and even the new ones. You know, everybody does things to suit their needs, and necessity is the mother of invention. So, you know, you have to kind of pull things out of your back pocket to make it work. And I'm really impressed that, you know, everybody's been trying to do just that.
Yeah, agreed. I think communication was probably a big takeaway for many of us.
Yeah.
Anybody else have? Oh, Martisha, what you got?
Yeah. Yeah, I was going to say, Carrie, that's exactly what I wanted to follow up with the next question is related to communication and how important it is, as you said, Cook, to make sure that we're communicating with our volunteers. And I just want to open it up to see if anyone has had any ideas or something that you've done during the pandemic to make sure that you were engaging and communicating with your volunteers. What kind of techniques have you been using?
Everything in email, you know, just constantly checking in via email, picking up the phone and calling. I think we tend to forget that the phone still exists, and we do a lot of sitting behind our emails. So if I don't hear from volunteers, or if I need somebody quick, or something happening fast, just picking up the phone and calling them and chatting with them over the phone and getting off Zoom. Because some people are remote, some people are still in person. So it's a matter of finding that where it works out best. Because if your Zoom's not working, then we just pick up the phone and call.
Love it. Love it. Kind of goes back to some of our previous discussions where we said you can have that personal touch. So maybe writing that note for that volunteer, just picking up the phone is so much more different than it was in the past. It's definitely more personal sometimes than Zoom. So any other ways that you've been communicating, or ideas or takeaways in communicating with volunteers during this time?
One other thing I'll say quick too is we've been really specific at target asks, like really specifically asking what we need them for, rather than just sending out and saying, here's, you know, the opportunities for mock interviews or guest speakers. We've been really particular in doing invitation to participate. Like we need specific academy support numbers. We need career awareness videos. Been really, really specific and asking what we expect from them versus putting it very broad.
I was thinking about I think it was Michelle maybe that was speaking, what she said about we have some volunteers that I've never met. Yeah. And realizing I've been doing this with Alignment Rockford since November, and we have a lot of volunteers, and many of them I've never had any kind of one-on-one conversation with. And just this week I put into my Outlook just time each week to set up one-on-one Zoom meetings or calls with volunteers, kind of off of what Jessica is saying, and making sure that I can eventually have a goal of meeting with every single volunteer one-on-one in some aspect to build a relationship, because I don't know necessarily what people's skill sets are. So thinking about how they had the historical society had people working on these projects. Well, if you don't know the skill sets of your volunteers, then you may not be able to think outside the box to utilize those skills better. So it just kind of came across to me that I really need to make more purposeful attempts to get to know people, because you don't have that after meeting time where you're standing around having coffee after a meeting like you used to when you were in person. So there's a lot more need for being intentional.
Love it. That is definitely key. Definitely seeing what we can do to be more intentional. And really, that's pretty funny that you said that, Esther, but I'm finding that it's really hard to get to know people. You don't have that pre-post meeting time to just kind of sip some coffee and chat a little bit with them. So you have to be intentional about that. Very good point.
Awesome. So Jessica brings up a really good point about specific asks, right? And it, especially in a time of uncertainty, we'll call it, being able to specifically say like, on the AR world, we call that an invitation to participate, right? An ITP. But that brings up a really great point about recruitment during, like volunteer recruitment during a global pandemic, right? So let's talk first about like, what are you doing to bring new volunteers into your organization? Have you, and honestly, have you stopped volunteer recruitment now that it's a little harder to engage volunteers, or have you kind of plowed ahead with this idea of bringing more volunteers and kind of maybe creating positions or opportunities for volunteers? So let's talk a little bit about recruitment. Anybody just stop?
We really did just stop.
Yeah.
We weren't open. We didn't need to do a lot of that. A lot of our staff was remote anyways. So we've spent the time more looking at our volunteer programming, rehabbing the way we sign up our volunteers. You know, we just went to Volunteer Hub, and we've done a whole sort of rehashing of what we ask our volunteers for and how we're going to ask them to come on board.
Right.
So we've spent more time doing that stuff.
Yeah, it is a really good time to like stop and just reflect, kind of look back, edit processes and policies, right? Give yourself a chance to like kind of take a deep breath and say, okay, moving forward, this is how we can do things better. Right. Tell me about those of you who are actively recruiting volunteers. Renee, what are we doing at the Will County Forest Preserve?
Thank you for asking. Most of ours is word of mouth, but we also still have our online versions of opportunities with Volunteer Match and court community service, etc. But our biggest one is word of mouth, and it's going surprisingly well. We probably had close to 25 to 30 new volunteers, and our volunteer orientations have been, actually they're getting better on here. We also have colleges and universities on here too. The remote orientation is like mask, social distance. I usually hand pieces of material like halfway between us, and they'll pick it up, and I bring sanitizing agents to have them sign. Probably the biggest change has been we do have a lot of outdoor work, and we've been able to really change the opportunities for volunteers. So if they're typically working in a facility that was closed on here or hasn't opened back up again, many of them have done their orientations with me remotely, and they're becoming outdoor volunteers on here per se. We've got an increase in our trail sentinels and an increase in our resource management volunteers. The trainings for both of those two sections have been on Zoom, and they've been on links. We send them links, additional trainings on there, so that they can make sure that their certifications and trainings are up to date. Yeah, it's been really, really busy. I put a couple of things in the chat that we're doing really well on here, which is, the newsletter I think has been tremendous. I'm working on April's now, April, May, and June's now. So it's touching base with the volunteers. Have I been as good as I have been in the past? Probably not, because there's so many of them. And in the past, I was able to, like people have said, talk to people during these meetings, but now you can't. So now you have to try to engage them individually. And I'm going to apologize to Barb. She probably has gotten more emails from me than phone calls, because I'm at the computer here and I can send that off, and I know I can touch base with her, but it's not my favorite way to touch base with volunteers, because you don't know what they're doing. Especially in Barb's case, seriously, she is not attached to her computer. She has other things that she likes to do. So if you really want to get a hold of her, you have to either pick up the phone and talk to her, or say, hey, I sent you something, can you spend some time on your computer to actually read it? And a lot of things that people do, you have to respect the volunteer, because they're not paid to do this, and they have other things that they want to do, and you have to respect that want and that desire. So
Yeah.
Again, my apologies to Barb. I'm grateful that she has stepped up and helped us to manage volunteers, which is taking a lot off my shoulders. So thank you, Barb.
Oh,
Yeah.
you're welcome, Renee. And I've become more involved in checking my computer because as we do more online activities through Will County, and I've been hitting other counties too for whatever reason, I'm checking more often because I get my video conference things online. So I have to check that too, but yeah.
Well, thank you. Thanks for your
Well, I think
insight on that.
I think we have a couple more suggestions here in the chat box. I see that Jenny mentioned that they use a closed Facebook group for their volunteers to help keep them connected. So that's kind of that's a really cool technique. There's another question, and Esther, I might ask you to expand on this question. You said, I would like to know what messaging is being used to recruit volunteers. Do you want to expand on that a little bit?
Sure. I forgot her name. Let me check my notes. The last person that spoke.
Colleen.
Pardon? Sorry, I didn't hear that.
Colleen.
Yes, she mentioned that they've used Facebook and advertising to recruit volunteers. And I'm wondering what kind of messaging she used in that ad that went out. I've thought about doing that. I do have a background in advertising. And so I was curious of what kind of messaging she did and whether she targeted it. Was it targeted at a specific age group? Was there other target? Because, with digital, you can target pretty narrowly if you want.
Yeah, I'm scanning here. I think she might have hopped off. Billy, you can find out for me.
Has anybody else utilized those forms of recruitment? Might be a dead in the water question.
Yeah, has anybody used advertising?
Yeah, I mean, I definitely say for the RACVB with Stroll and State, we've definitely advertised a lot of our volunteer opportunities within Stroll and State. Definitely a heavy push on social media, not just our page, but if there's opportunities to expand that and communicating with partners. I think there definitely is room to make sure that you actually get down to the type of volunteer that you would like to recruit. I mean, we've just talked about some of the opportunities. If there's something that maybe you need someone that's a little bit more technologically savvy, maybe you're going for someone within that demographic that can assist in that way. So I think it's a great idea. In terms of verbiage, you said something, Carrie, that I wrote down here on my notes and I circled. I said, we're gonna have to figure out some way how to steal that and use that for promotion, but you said an invitation to participate. And the reason that stood out so much to me is right now with what's going on with the pandemic, we don't have the opportunity to engage and participate. And maybe that messaging is something that really would resonate with individuals. It's an invitation to participate, an invitation to belong to something. So I kind of wrote that down, Carrie. So if you see it out there, I'll give you full credit.
No, it's on the record. You should give Jessica and Esther and Anisha all the credit. That's an AR term that we've used for years. We put out a formal, it's like a formal invitation to participate. Yeah.
Yeah, I love it.
Esther, I'll take my moderator hat off and put on my Habitat hat for a second. So we do, we have a pretty robust advertising budget on a monthly basis. And so for the Restore specifically. And so we use digital advertising. So we use Local IQ. I think they're through the Rockford Register Star. I think they just got bought by the USA Today, but whatever, that's even better for us. So we do digital advertising. We do radio advertising. So we have radio spots on several stations with Midwest Family Broadcasting. And then we advertise in Smart Living Weekly. And then of course we use social media, posting, posts, and we, have a budget for those as well. I know lots of nonprofits don't have the same kind of budget we have, but we're also running a retail store. So we, in the beginning of the pandemic, converted some of our newspaper ads and our digital ads and our radio ads specifically for volunteer recruitment. And it was, the call to action was, we need you. Okay. So we're currently in the middle of a volunteer push right now, which has been unbelievably successful for us. So in terms of new volunteer recruitment, we do use paid advertising, but we also use all of the traditional recruitment stuff. We call the local churches that we have relationships with and say, Pastor McKenna at St. Mark, can you put a blurb in your bulletin this weekend and from the pulpit say, our friends at Habitat need your help, right? And so we do all of those kind of like free recruitment methods as well. In terms of re-engaging our volunteers, once we got to a point where we could invite volunteers back and we reopened the Restore and we reopened our construction sites, the campaign was We Missed You. So we did this whole graphic around, we missed you, will you come back? And some people were like, I will come back as soon as it's safe. I will come back as soon as I'm vaccinated, I will come back, and so much like Renee said, we keep in constant contact, through newsletters and emails and those kinds of things. Most of our volunteers are in that 55. Actually, most of our volunteers are in the 70 plus age range, because that's what Habitat does. But we, we don't use social media as much for, those kinds of things, but we do use email and phone calls. So it was we need you message for new recruitment, and it was a we missed you message for retention.
That's very helpful. Thank you.
Yeah.
I do have a background with digital and television marketing, but it's just really interesting to understand how other organizations utilize that, because it's so much you can really easily get lost in the weeds.
Yeah.
With it, because it can be overwhelming.
Yeah.
Follow-up question that I would love to hear how other organizations have done this. How have you built your, if it's okay if I ask this, how have you built your likes and followers on your Facebook pages so that more people in the community kind of hear through that free mechanism of just posting stuff on your Facebook page, what's going on with your organization? Is that fair to ask?
Of course, that's a great question. Everybody jump in. Who's got a good answer for that? How'd you build your Facebook base?
I'll chime in.
Awesome.
It is a lot more difficult now to get an organic reach. Facebook has changed their algorithm significantly, so they are really pushing for people to do paid ads. Something that has been really successful for a lot of the organizations that I work with or talk to is making sure you're tagging other organizations in your posts. So if you are doing co-events or co-sponsoring things, or if somebody came and volunteered and spoke at your conference like today, when you do that, thank you, tag their organization, because you take advantage of your reach and their reach when you do that.
I would add to that, especially on social media and increasing those followers. See if there's an opportunity for you to highlight either a volunteer or a team member that may be well known in the community or may have some of those connections that really help to pull those heartstrings. I'll give you guys a specific example. We're really working at the RACVP to increase our engagement with minority individuals on our social media. And so with it being Black History Month just yesterday, there's a young man, an up and comer. I am such a fan of him. His name is Tamir Bell. He does videography. He's like 17 years old and like, I don't know, brilliant when it comes to like marketing and promotions and doing videos. And so we're working with him on the project. And I said, well, you know what, Tamir, do you want to give us a quote and explain to us what does Black History Month mean to you? And we're doing that with some of our local and community members. And I kid you not, I mean, this kid probably has over like 300 likes right now. Between all the individuals that have shared. It's been shared like 26 times. And it's something that he's passionate about. And it gives us an opportunity to show that we have that relationship and really just celebrate what he's doing to help us to help make the community better. And so I would strongly encourage, I think if there's an opportunity to highlight a board member, a volunteer, and let them and their relationships help expose and increase your likes, I think that's a good tool to use.
Tamir did 2 videos for us too, by the way.
I love him.
Yeah,
he's awesome.
he's very talented, very, very talented.
One of the things that we do, I stole this from Transform Rockford, so you can steal it from Transform Rockford too. But one of the things we did was we asked a handful of people who liked all of our posts on Facebook. They ended up being, board members and staff and key volunteers. We specifically asked them to be our social media champions. And we asked them to share our posts and to comment on them so that would show up in their news feeds as well. And then our communication manager goes in and immediately invites every person who liked our comment that isn't already a fan of our page. I still call it a fan. I'm sure Mark Zuckerberg would kill me for saying that, but whatever, Mark Zuckerberg, I don't care. But if you like a post that so Stella Schroeder is a perfect example for us. She's super well connected. She belongs to every service club and organization in the universe. She loves everything Habitat does. So she shares every post, and then we go to her share, and every person who liked her post, we invite them to like our page. So Facebook gives you that option. Esther, I'm sure you know that, but Facebook gives you that option that you can click on all the people that like it, and then you can invite them. And so we've been able to build that pretty dramatically. And we only have 20 champions, right? We've had this kind of handful of people that have really helped us build our base on social media. We pay for ads too.
I like the idea of having social media champions. And
Yeah.
I have a friend who has a boutique, and I'm one of her brand ambassadors. She gives me 20% off to post stuff I buy from her. So maybe taking that and rolling that into having team members be social media champions. And that's a fantastic idea. Thank you so much.
Yeah, give all the credit to Transform Rockford.
Love it.
Yeah, I think it's really being a part of the Transform Rockford engagement team. I think part of the reason it was so successful is because there's individuals who want to volunteer, but they may not have the time to volunteer. So if it's something as easy as a quick share of something that's been posted, then they can feel engaged and a part of the mission, but maybe they can't put in those, 20 hours a month or whatever is called for volunteering. So that's a great point you brought up, Carrie.
So could I piggyback off of that and ask a super specific question? But this is something I was trying to get going with us at Safe Passage. And I was wondering about if it's possible to record those volunteer hours. If you, with social media champions, do you track that?
We do.
And how do you track that?
Yeah, we do track them. So we have a couple of different systems. So if you show up at our restore, you just go to the computer and you log into the T-sheets. You log your hours through this online app that we use. But if you're volunteering from home, so say you're, we asked one of our volunteers to transpose all of our handwritten board meeting minutes from 1988 into Word documents. We just give them a timesheet like we give our families, right? Our families have to track their time. So we have this super generic timesheet, and every time they do something from home, and that can include, our social media champions. We just ask them to record that and then turn that in before the end of the month. And then we report that, with our volunteer hours to both Habitat International and our board. So
there's a company out there called Let's Thrive 360 or Altruize. Yes. She would be another one. Nicole Sadao.
Yep, Nicole.
There's an app on your phone if you download, and we have it at Alignment where we're just starting to use it. Personally, on our own volunteer hours, as well as our volunteers at Alignment, we've not really completely launched it yet, but you may want to look that up, or I could give you the reference to her. And it's just an app where you log in, and any volunteer can log in their hours to whatever organization they volunteer to and log their hours. And then you would be able to track those hours as well.
Yeah, she's really cool. She's from Freeport, actually.
Yeah, she started she did some career stuff for us because she has an awesome story. She started out as a chiropractor and then ended up opening her own business. And now she's got this as an entrepreneur. So she does a lot of guest speaking for my college and career dining students because of her story.
And Mary Beth, I don't know if you saw in the comments, but Renee says that the Will County Forest Preserve uses Google Sheets.
Okay, thank you so much.
Yeah, of course.
Carrie, I have a specific question related to that. Or do you have a threshold that if someone is posting, you're giving 15 minutes, 30 minutes of volunteer credit? How do you? Yeah, we do. Yeah, we do it in 15-minute increments. So we give you, you get a 0.25 credit if you volunteer for 15 minutes. Mm-hmm. Yep. And we give them a little chart when we give them this is so ridiculous, but we give them a chart when we give them their timesheet that says a half hour is 0.5, not 0.3. 45 minutes is 0.75, not 0.45, right? Otherwise you see, you end up,
sometimes we have to convert them, but we give them a little chart and an explanation and their timesheet. Yeah.
Good. So I wanted to ask a question about benefits for volunteers. We know how important that is, that they have to feel not only engaged, but they have to feel the benefits of volunteering at your agency. And with it being a pandemic, some of the ways that we have shown those benefits in the past, maybe dinners or breakfast, lunches, things of that sort, we can't do anymore. I really want to know from you guys, what are you doing to communicate and give benefits and celebrate your volunteers? And this is a selfish question, but I really want to know what you guys are doing to celebrate your volunteers in this time. Barb?
Last year, instead of having our volunteer banquet, we had little group events. Mine was held outside. We had about 30 people socially distanced. We celebrated the volunteers that worked in various areas within, like say one group, like let's say it was the restoration volunteers. We acknowledged them. We handed out award pins, award documents, and celebrated everybody. Renee had ordered box lunches to keep it safe and, you know, less handling of foodstuffs and things like that. And it was a very, very wonderful little celebration. We had several others for the various other groups as well. And this year we are having a virtual celebration in April. And the awards will be mailed, I believe, to all the volunteers that are receiving awards. So we're still going to be together, but distanced. And I think it's going to work out really well.
She's correct. The awards and certificates. I'm actually, after this Zoom meeting, I will be dropping off the Presidential Service Awards to the post office, so the individual will get theirs earlier. Saturday, I sent the gifts to the different departments on here so that the volunteer coordinators can make arrangements with the volunteers to pick up their gift when and if they feel safe to come in on here. So yeah, we're moving in a different way. The biggest complaint that we really had, and it was from one of our 87-year-old volunteers, is I miss seeing your face, because you can talk to people, you got your mask on, but you really can't see your face. So I have been quite good at figuring out if people are smiling by reading their eyes. So I think that's the new trend that I'm taking away from all this, is I don't necessarily look at your face specifically, I look at your eyes. So if you see me looking at your eyes, it's because I'm seeing if you really understand, or if you're like, Renee, it's time for you to go back on vibrate or whatever it is. So with that said, I'm gonna go mute myself.
Oh, we are definitely learning more about body language. Definitely we are.
Yeah. Martisha Beth wrote in the comments that they had a drive-through awards program in the fall and had goodie bags for their volunteers. I think that's a great idea. Like, if kids can have drive-by birthday parades, why can't we have drive-by, award ceremonies for volunteers? Great idea, Beth.
And I want goodie bags too, so I love that.
One of the things we did and really focused on was nominating volunteers for awards. So we spent, a decent amount of time kind of like trying to find different opportunities to recognize our volunteers. And so we've had some really great luck with WREX's Inspiring 815 awards. And so we've been able to, kind of put some people forward for that. We applied for one of the governor's Hometown Hero Awards or Service Awards, and one of our volunteers won that. Right now, we're in the process of applying for the Governor's Hometown Award. Like, we want to make Rockford one of the Governor's Hometown Awards for their work with Habitat in Guilford. So we've been trying to find unique ways of recognizing our volunteers through like awards through the community, and even, statewide awards.
It's awesome. Thank you guys for letting me gather that information.
So, okay, so one of the things, this is a great conversation. I felt like it was a really, a lot of information that came at us from the three speakers, but there was something that Alicia said in the very beginning of her presentation that I wanna chat about. And I will be interested to see if any of you also felt the same way, but she mentioned rage donations. Yes. So, right, that whole concept of the ACLU raising a significant amount of money through times of crisis, how much money the Black Lives Matter movement made, even you can see that through the GoFundMe pages of several of the people who were killed over the spring and summer, Breonna Taylor, George Floyd, right? I mean, millions and millions and millions of dollars flowed in for the ACLU and families of violent police violence. So let's talk about that. How are we, when something kind of terrible happens, how does your organization use that? Or how does your organization respond to those kinds of things? And did you see an increase in volunteerism at your organization or at organizations that you're involved with? Did you choose to volunteer? Like, did you choose to go out and do something because you felt strongly about a movement? Tell me about your thoughts on that, either donations or volunteer time.
To chime in to say that we have been extraordinarily careful as our organization around this, so we're domestic violence and sexual assault and could have made certain connections, but we're sort of really careful to not come across as if we were trying to capitalize on pain and to make something about us that isn't about us, and not to look like we're trying to profit off of something. So I think it's been something that we've had internal conversations about, or sort of statewide coalitions have had conversations where some other agencies got into some hot water for backlash for the way that they tried to fundraise around rage fundraising. And so I don't have a solution to it as much as to say that I think it's something that it's important to be sort of really mindful of all of the dynamics around.
Yeah.
I think we were kind of in that same boat, is that with all the social issues going on in our world, the last thing we needed to do was try to step into that. We preserved a lot of it. We have a lot of great collections now that we've put together for the future, but otherwise we kind of have stepped out of the conversation. We'll be the collectors of that those conversations, but we're not getting anywhere near trying to put ourselves out there in the discussion.
Yeah. Any other thoughts on that? We started a diversity, equity, and inclusion committee at our Habitat affiliate. Habitat International also hired its first global diversity officer and made diversity, equity, and inclusion a founding principle of our international organization. It's what we do, right? We are built on a premise of social justice, and so we made a stand. We made a public statement. We created a diversity, equity, and inclusion committee. And we have more people on our DEI committee than we have on our board of directors. So people were very interested in joining that conversation. And they were interested in furthering Habitat's mission. But some people came to that table just hungry to do something. And not necessarily rage-based, right? She referred to it as rage, donations, which, it clearly is the case. I mean, the ACLU made a stupid amount of money. But like for us, it was people, more so people were really interested in being a part of the solution. And which is what we promised, right? When we made our public statement, it was like, we will no longer be a part of the problem. We will be a part of the solution. So we launched an educational series, thanks to the help of NCME and several other community partners. We were able to kind of launch this educational series. And Billy was part of our last book club conversation, but we've read several books and watched TED Talks and read articles. And lots of ours is, geared towards affordable housing and how affordable housing was, housing discrimination was created by our government. I mean, there's proof of that time and time and time again, and that in order to undo those policies, organizations like Habitat have to step in and make changes to their policies. So we found an influx of volunteers who were very interested in being a part of our conversation and a part of our diversity series because they were hungry to do something. And we made a pretty bold statement in the beginning, but we're also an organization that is built on this idea that everybody, no matter what color your skin is, no matter how low income you are, you deserve a safe place to live. And so we can't sit out of the conversation, right? And so we had some great success in engaging people that we hadn't been able to engage before. Harlan, I'm shocked that you came off camera for this conversation. Tell me your thoughts.
Yes, I'm sending something into the chat right now.
Okay.
And it's regarding the whole issue of rage and where that fits, because I've always thought of anger as being a wonderful, useful way of understanding unmet needs, because when you're really, really, really not getting your need met, you get angry. But if it gets to rage, it's destructive. I have a totally different perspective on that now, but it has to be in context. And that's the People's Inauguration. Valerie Kaur, K-A-U-R. Google her TED Talk, and then go to the link that I put on the chat and volunteer yourself to spend 10 hours or 20 hours, a long time, watching the videos. There's one on each day. There's 10 of the videos. The last digit is a 1 on the one that I sent you, and each one. And I saw it live, partially live, and it's transformed my life. And it relates so much to the issue of volunteerism that I encourage you to do that. That will equip you with some things that you didn't even know you didn't have. Thank you.
Thanks, Harlan. That's awesome.
I would add to that too, Carrie. I guess when I look at the word rage, sometimes it's really strong and it's powerful and it kind of hits you a little bit and you're like, whoa, that seems aggressive. But when I really look at the word rage, it really just means that someone is furious. And you can be furious about negative things going on and you want to be a part of something positive. And so I think that what specifically with the RACVB, working with the Coronado BMO Harris Center in a couple different committees on making sure that there's equity as it relates to entertainment and welcoming diversity and having these conversations. And I kid you not, when I reached out to people and said, hey, would you want to be involved in this conversation so that we can make some commitments to our community? There wasn't a single person who said no. They said, I've been looking for an opportunity to be a part of this conversation. And from those conversations, there's some specific things that they've asked us to do that I think will be some sponsorable opportunities. And it won't necessarily be to take advantage of the rage, but it will be to take advantage of making a shift, because people are furious about what's going on when it comes to inequities and injustices in our community. So what can we do to be a part of the solution? Again, I just reiterate, I think that word rage seems so aggressive, but you know what it is? We're furious about injustice. Yeah. And that's okay. We're going to make it right.
Yeah.
In Valerie Kaur's book, there's a whole chapter on rage. And she embraces it and understands how if you are able to do it in a safe container, it can liberate you from being constipated in many ways in your life where you just aren't able to do things because you're holding that rage and not able to let it go, and then let it then inform you about unmet needs. Thank you.
Well, I think we have just a little bit of time. I guess I'll just ask an open-ended question with the conversation that we have. Do you guys have any takeaways? Is there any action items that you have as a result of our conversation today?
I'm going to do a parade. Nobody in my team knows it yet, but I'm totally gonna. So I can't remember who gave us that idea. Beth, maybe? Was it Beth? Yeah, I'm sure my volunteer coordinator is going to be real happy about that today when I say maybe for Volunteer Appreciation Month, we do a parade. So, but I love that idea. I think that's really cool. Like we could, Beth, it was you, Beth. So if you get a call from Greta Sanders, no, I'm kidding. Yeah, I think that's a great idea. I think that's a really cool, yeah, like we participated in Trunk or Treat this year that Two Men in a Truck did at North Christian. And it was so much fun that I think we could just have so much fun with that.
Awesome. We have some ideas here in the, or some sharing here in the comments. Better to touch base with volunteers. I think that's definitely a takeaway for me as well. And then I see here, if we take the word rage and we do not assign a meaning to it, but let the person coming in share their meeting and let them be a part of the conversation. That is a fantastic takeaway. So awesome. Perfect. Well, I think we're just about wrapping up. So we might hand this back to Billy to close us out here. And thank you guys. Thank you so much for the conversation. This has been great.
As always, thank you.
Great, thank you so much. Thank you, Carrie and Martisha, for leading a fantastic conversation this morning. And thank you, of course, to our speakers. I know they're not with us, but of course we thank Alicia and Michelle Donahoe and, oh gosh, I would lose that, wouldn't I? Our third speaker this morning.
Colleen.
Thank you, Colleen.
Colleen
I can remember her last name, but I didn't want to call her by only her last name.
Yeah.
I'm going to share my screen with you. I do have several events coming up in the world of NCME that I think you'd all like to know about. Some of them you may already know about if you read the email that I shared out yesterday. Here we are. Wait for my screen to go to presentation view. Beautiful. So I wanted to share the fact that we have on Friday starting free DEI training for nonprofits. I know I've seen some familiar names come across my screen of you in the group who have registered, but I will share there are only about 17 spaces left. We're at almost 500 people. If you miss out on the opportunity to make it into that group, know that we're going to record events. So if you want to join the waiting list, you can do that. We will share the recording out for you afterward. But Dr. Adrian Coleman and Dr. Tracy Ellis of Candid Conversations Matter will be leading a group in conversations around how to examine your unconscious biases, how it impacts organizational outcomes, and how a lack of awareness about concepts such as white privilege and fragility, systemic inequities, and lack of cultural competency really do affect the outcomes of our organization and how we interact on a day-to-day basis. So the session will run from 9 to 11 a.m. It's going to run for 4 months. So watch for that. If you don't make it into that group, we're also doing a Courageous Conversations Facilitator training. That will be held on March 19th. There's plenty of room there still. We're a little ways out. So if you miss out and you want to be able to lead conversations around social justice and racial inequities, if you want to be able to hold those conversations with confidence, please join us for that training. That is also free, and I will share that it's going to be led by Dr. Tracy Ellis of Courageous Conversations Matter and Ellen Amer, who's a local facilitation expert. Some of you may know her, so we hope that you can join us. Both of those trainings are made possible by a partnership with the United Way of Northwest Illinois and a Healing Illinois grant. You can find more information about both of those and sign up at our Eventbrite page. So if you go to our website, it's www.niu.edu/NCME and click events. That'll take you right to our Eventbrite page, and it'll show you all of that information. We have our certificate in nonprofit management program coming up. So if you are working to build your leadership skills, or if you're a nonprofit leader already and want to refresh your skills or broaden your network, we encourage you to consider joining that. That is a paid program. If you're a NCME member, you do get a significant discount for that. But starting on March 4th, Lori Burkus Nelson is going to lead the Leadership, Management, and Governance course. That will help you understand leadership, how to be a better leader yourself, how to cultivate leadership within your team, and all of those themes listed there. We encourage you to come. That series you can take in any order at any time. The course credit does not expire. So if you just want to take one course, some people do that. That's entirely fine. Or if you want to take all 5 courses in a year or across 3 or 4 years, that's fine too. I will share that we have strategic human resources management training coming up as well as part of that series. That'll be led in April by Ginny Weckerly, who's the human resources director at Goodwill. The other sessions there are listed below. I'll share more details as we get closer to those. But if you want to learn more about onboarding volunteers, onboarding staff, cultivating that talent, and making sure you're staying within the law, doing all of those things, you would learn more there. We have, as part of our Rockford Area Case Management Initiative on March 17th, our Community of Practice. Now this event is free and it's going to be hosted, of course, by us and led by Mary Cassiope, who's the Executive Director for One Body Collaboratives. She's going to lead a training on the Bridges Out of Poverty framework. So if you want to understand how poverty affects all areas of life and is a huge factor in every service area. So probably every person in the room may deal with people that live in poverty or struggle with poverty. You can learn that here. I will share, we're excited that this is free. If you look up Bridges Out of Poverty training across the country, you will most likely be finding classes that cost a significant amount of money. So the fact that she's sharing this introductory course for free is a great privilege for those in Rockford and those here today if you want to attend. If you have questions, of course, email me. I hope you all have my email address. And the very last thing that I'll share with you this morning is our next session. So on March the 3rd, we have Kelly Kleeman of NFP Consulting, who's going to lead a session on how to use and find high skill volunteers. So really excited about offering that with you. I'm going to stop my screen share. Again, thank you this morning. It was wonderful to see all of you, and we hope you have a great rest of your week.
Thank you.
Thanks, everyone. We'll see you next month.
I think that someone also said, that the topic didn't really fit the conversation today. And I know that our speakers pivoted as a result of COVID. And so what we'll do is we'll take that to heart and look to see if maybe we can push something at the end of the series that does address large events so that we can make sure to cover the topic when it's appropriate and when people are able to gather in large numbers again.
Yeah, and I can take that too, Pam. Even if we don't do it as part of this series, we can do an exchange on volunteerism. Yeah, I'd be happy to help with that too. Yeah.
Thank you very much.
Yeah, of course, Terry. Yeah.
Yeah.
Yep.
All right. Stay warm, everyone. Great to see you. See you next month.
Thank you.
Thanks, Carrie. Thanks, Martisha.
Of course. Bye, friend.
Bye.